presentations on that because it is your last chance at that today's special value. But underneath your fabulous color, you need fabulous skin.
Your sexiest accessory is your skin.
I'm
biased, but that's what I think.
Dr. Will Kirby's joining us. How are
you?
Mwah.
Wonderful
Great
to see
seeing
you. Friday Night Beauty, Lisa Robertson. I couldn't be more excited to be here.
You are always so
much.
kind. And by the way, I don't pay him in cash. I send him, I don't know, fresh fruit
only.
or something. So Dr. Will Kirby, of course, is a board-certified dermatologist, has a very, very busy practice out in the LA area. You've seen him on many shows where he is there as the expert and the doctors, and the list goes on and on. But he is one of the skincare professionals, one of the doctors who is all about results, who wants amazing results for himself and for his clients, and was really intrinsic and instrumental in the creation of this very, very scientific, professional level, intensive skincare line called Neutrogena Dermatologics. This is not the same Neutrogena that you find in other places.
Correct.
And that's a great line too. This is going to be way up.
Professional level solutions.
That's a huge difference,
Very
by the
much
way.
So. Very, very much so. I mean, this is cutting edge technology, and I always tell my patients, if you want to meet the least hypocritical dermatologist in the world, you're looking at him, because this is the exact same product I use on my own face every single night, and it's what I recommend to my family. So if you don't want to take my word for it, and you don't want to look in the medical literature and look what thousands of publications testify as the best single ingredient and product you can use, you can also look to your friends and peers and look at, because it was the 2011 Customer Choice Award winning for Best Anti-Aging Serum.
And what we're talking about is a very unique concept in retinol.
Correct.
Delivery system, concept, formulation. This is retinol that is going to be, again, professional level. This is the supersize. Normally we offer it in the 1 ounce. The 1 ounce is $65. Here you're getting 1.7 ounces. That's almost twice as much for 3 payments of $26 and change. This easy pay goes away at the end of this show. The end of this show. This is the most popular product in the Neutrogena Dermatologics line.
Correct.
And this is all about the retinol, right? So when somebody comes to you and says, Dr. Will, I want my skin to look better, I'm really noticing that it's aging, what do you tell them?
Single best 2 things you can do. Sunscreen every single day, broad spectrum, and at night, stabilized retinol technology. This should be the first thing that comes in contact with a clean face every single night. And it does have that stabilized retinol, and what does that mean for you? Smoother skin, softer skin, more supple skin. It also has Tetrol E, firms, tightens, restores elasticity.
Because I think sometimes we think, well, retinol's been around a while, so there must be something new and better on the block. But you're saying, as a skincare professional, as a doctor, as someone who's treating patients in your office every day and making sure that your skin looks great, because by the way, I think there's a picture in your attic, but literally you're saying there is nothing that's going to give you the anti-aging results of retinol, especially when it's done at this level with this delivery system in this formula, right?
That is 100% correct. Superior anti-aging benefits is what is the phrase we associate with this product. And I always tell people, it's not what's the newest thing in your medicine cabinet, it's what's the thing in your medicine cabinet that works. And the truth is, this is new. The way it's formulated, the way it's stabilized, this is absolutely a cutting-edge technology product. And that's one of the reasons it's so incredibly popular, because it really works extremely well in offering you that anti-aging beauty benefit that women love to see this time of year.
By the way, I know that a lot of you already own this. If we have a chance, we'll talk to some people on the line, but again, I know we're going to be busy. I want to let you know that this is auto delivery, which is going to be every 90 days. This is one where if you go on auto delivery, you're locking it in every 90 days. You can always cancel, skip, delay, but yours is, going to be there every 90 days. You're going to lock in the easy pay, which is a fabulous way to go. And one of the things I just want to remind you of is, number one, when you have clean skin, this goes on first.
Correct.
If you have another anti-aging serum, you're going to put that on after.
That's correct.
But this is what every professional tells you. If you want to do your homework, go do your homework. But I would say, get this now. Lock in the easy pay. The easy pay goes away at the end of the show. Lock in the easy pay and see what it does for you. Give it 60 days. Because that is what's really going to make the difference in your skin, right?
The adult skin cycle is 57 days, 60 days. So we talk about 8 weeks is really what we like to see. And that's where we quote studies from. 92% of users after 8 weeks showed improvement in the appearance of fine lines. So 57 days, 8 weeks, that's our benchmark. And this is a 90-day supply. So within just a couple weeks, you're going to see a beautiful, beautiful difference.
And one of the things I love, too, is that I think, again, it's not the retinol that we used to have. It's not something that's going to make you have to stay home for a week. It's not something that's going to be horribly expensive and I have to go get a professional prescription for it. I mean, this is accessible, it's affordable, it's professional level results.
100%. People always say, well, what am I going to see? And I tell them smoother skin, softer skin, more supple supple skin. Sounds a little difficult to say there, but it is very, very factual. And if you look at a child, they have a very fast cellular turnover of their skin. But as we age, that process slows down and your skin loses its luster, it loses its hue, it gets dull. So restored luminosity, increasing that surface cell turnover, that's what this gives you. And you have to remember, it is a treatment, professional level solution, not a cover-up, not a makeup, something you use every single night, and it will absolutely make a big difference in the aesthetic appearance of your skin.
But you know, one of the things that I love is I'm looking at this and going, wait a minute, this is 3 payments of $26 and change.
Very reasonable.
This is very, very affordable. You can spend a lot of money for retinol treatments. You can spend a lot of money, you know, and again, you should see your dermatologist, absolutely. But when it comes to, I just want an amazing retinol, I want something that's proven, I want something that's really going to give me results, and I don't want to spend $1 million. This is the best-selling item in the entire Neutrogena Dermatologics line. This is so popular, we supersized it. This is so popular, we offer it on auto delivery. That tells you that women are seeing results. And very quickly, we're going to say hi to Melissa.
Hi, Melissa.
From Virginia. Melissa, say hi to Dr. Will Kirby.
Well, hi, Dr. Kirby.
Hi,
Lisa.
Thanks
Hi,
for calling
Melissa.
in. How are you?
I'm doing great. How are you doing?
Good. Have you been using the product?
Yes. I've been probably using it for about 3 months, and I was telling the lady I was talking to before I got on the air that I guess I was more skeptical than I thought, but I couldn't believe how it got rid of my 11, or actually I think it was 111 I had up there. Now I just have a 1, so I'm working on that.
You know, it is indicated for those fine lines, and you can use it for the entire face. 92% of users in 8 weeks showed an improvement in appearance of fine lines. So I think what you're describing there is a very, very nice result, and that's an aesthetic change I like to see and like to hear about.
Well, and I like seeing it.
Absolutely. Absolutely.
Like I said, I was surprised, although I've been shopping at QVC for about 20 years, and I've liked so many things that I've tried, and so I thought, well, you know, I'll try this and see, and it's just been really great.
Well, the results are
so
cumulative
glad.
over time, so just like working out, you want to stick with it, use it every single night, and you will continue to see a great beauty benefit over time, Melissa.
Well, I am sticking with it because I have seen results, and boy, if I keep seeing more results, I'll keep on being happy.
Melissa, thank you so much.
Have a great evening. Thanks so much.
I'm so glad you called. Thank you.
Thank you, and I love you, Lisa.
Thanks. You too, Melissa.
Okay, have a good night.
You too. Bye-bye.
Bye-bye.
And just one thing I just want to mention very quickly, because we were looking at Stacy put it on, she was putting it right under her eyes.
Yes.
And we forgot to mention that because, again, most retinols, they say, don't get it near your eyes.
Safe for the entire face, dermatologist tested, ophthalmologist tested.
And
very,
you know what?
very well tolerated.
Here's where you need some retinol, boys and girls. And most retinols, they say, don't put there.
Yeah,
this, put there.
Thinnest skin on the entire body is around the eyes. So,
you know, I just think it's so affordable, it's so easy, it's so accessible, and that's the one really principal foundation difference in skincare. You can add to whatever you're using. That's what doctors tell you to do. Retinol, add it to whatever you're using. So stay on the line for that. I know we're busy.
thank you so much.
Dr. Kirby, thank you. Great
Wonderful
seeing
show.
you.
No, the pleasure's mine.
Thank you, thank you. That is a 210-085.